Well, why don't we start introductions so we can get ourselves moving along, and then as CAC members, as anybody joins, hopefully we'll get to a quorum and we can have them introduce themselves at the tail end. Kelly, can you help with this?
Yeah, I can definitely help with this. Excuse me. We'll start with our CAC members. We'll go with Brad and then Ken.
Everybody, Brad Porterfield, CAC Chair, Consumer Rep, and the Team Community Association. It's everybody.
Good afternoon, everyone. Ken Wilhelm. He, him, his pronouns. I'm with United Way of Deschutes County. I'm a CAC member.
Great. Our next CAC members, we'll have Tom and then Mandy.
Hi, Tom Kuhn, CAC member and Deschutes County Public Health Representative, he, him, his.
Hi everyone, Mandy Seeley. I use she, they pronouns. I'm a CAC consumer rep and also on the stable housing work group.
Great. And our other two CAC that are here right now, Connor and then Stacy.
Hi, Connor Carlson, CAC member, and I work at Family Resource Center.
I'm a CAC member, consumer representative.
Great. That is all of our CAC so far. Let's go to the Health Council staff. Let's do Donna and then Michaela.
Good afternoon, everybody. Donna Mills. I serve as the Executive Director for Central Oregon Health Council, and my pronouns are she, her, and hers.
Hello, everyone. Michaela Arsenault, Project Manager at the Central Oregon Health Council. My pronouns are she, her, and her. And I'm a CAC co-coordinator with Gwen. So I support your work behind the scenes and do a little coordination.
Next, Gwen and then Renee.
Hi, Gwen Jones, she, her, hers, co-coordinator, as Michaela said, and ditto.
Hi, everyone. Renee Worth. I am a project manager with the Central Oregon Health Council, and my pronouns are she, her, and hers.
And then Camille.
I'm Camille Smith. I'm the admin at the Central Oregon Health Council.
And I'm the last member of the Health Council, Kelly Adams, Admin Services, she, her, hers. Okay, so now on to our support staff and our guests today. Let's start with Kristen and then go over to Tanya.
Hello, my name is Kristen Tobias, and I am the Community Health Coordinator for Pacific Source in Central Oregon. And I act as a liaison between the CAC and Pacific Source.
Hi, everyone. Tanya Curiel, Regional Outreach Coordinator with the Community Partner Outreach Program. I serve Central Oregon region, and our team trains and certifies OHP application assisters. And so I support community partners across the region who are doing OHP assistance work. Thanks.
Great. Next, let's do Sarah and then Jessica.
Hi everyone, I'm Sarah Dobra, she, her, Aya, and I am joining today standing in for Rebecca Donnell, the Innovator Agent working with the Pacific Source region. So I'm happy and privileged to be here on her behalf. Thank you.
Greetings and good afternoon, everyone. My name is Jessica Waldman. I'm the Appeals and Grievance Manager at Pacific Source Health Plans, and just here to support one of the discussion items today.
Did I miss anyone? Okay, I think that's who we have so far.
Okay, we're almost 10 minutes past 12, so we are gonna need to move along. Is there anyone who would like to read the land acknowledgement today? We can put it up on the screen, right? There it is. Anybody want to volunteer? Tom, go for it, Tom. Thank you.
Okay. We recognize and acknowledge the indigenous land of which we live, work, learn, play, and grow. This is the land of the Warm Springs, Wasco, Northern Paiute, Tenino, Klamath, Molalla, and Yuskin. We acknowledge them as the past, present, and future caretakers of this land. It is on their traditional land where we partner to improve the health and well-being of Central Oregonians. We aspire to be good guests, honoring the concept in the Warm Springs culture. This land is for you to know and live upon and pass on to the children. And I apologize if I mispronounced anything.
Thanks, Tom. Appreciate you doing that. The meeting practices, are we going to put those up on the screen just to remind ourselves that to make our time together more welcoming, as welcoming as possible. We just want to try to use plain language, avoid acronyms as much as possible, things like that, but also just words that aren't used on a daily basis by the general public. Keep things plain and understandable. We've renamed everybody, given everybody either a CAC prefix or a guest prefix or staff prefix, things like that, to give us an idea when we look at the screen who's with us and who they're with, representing. Referring to what are often called minutes as notes, just because why call them minutes? They're notes. That's some of the plain language. Reaching out, I'll do my best to, the Zoom environment is still not the most comfortable, but do my best to reach out and ask you for input directly if I don't hear you speaking up as the chair. But others can also do that. If I fail at that job, I welcome anybody to remind me. And we're going to spend time together here shortly. We'll spend the first 10 minutes of our meetings or the first 10 minutes of our true agenda at each meeting in small breakout groups to get to know each other. And I think from what I hear, everybody's really appreciating that time together. So we will continue to do that. Any questions about these changes? They're not new, but we've been working on them a few months. Thanks.
Brad,
yes.
Elaine and Teresa joined us.
Oh, good. Okay. How about inviting them? Elaine and Teresa, would you like to, Teresa first and then Elaine, introduce yourself?
Oh, I'm Teresa Olander. I'm a community representative. I had a hard time getting on this morning. Never got an email with the link, so Gwen just sent a link, and hopefully Virginia. Is that right? Elizabeth, thank you. Will show up too, because we were in an old meeting. We tried to access meetings via older emails. Anyway.
We do have Elizabeth on the phone. Yeah.
Oh, good.
Yeah. Elaine, and then Elizabeth.
Elaine Seashield's a community representative on the CAC. I'm going to say it's medical.
Elizabeth, would you like to introduce yourself? Oh, connecting to audio, it says. Give her a second. Elizabeth, can you hear us? Can you hear me? If you can, please unmute and introduce yourself. Okay, well, we'll give Elizabeth another chance once we see that she's hearing us and engaging. Let's move on to public comment and patient story. I'm not aware that we have a patient story. Is there any public comments, or would somebody like to share a patient story?
I finally got in.
Oh, good. Go ahead and introduce yourself, Elizabeth.
Hi, I'm Elizabeth Schmidt. I'm a CAC member. And I'm running for assistant chairperson. And
Fantastic.
yeah, thank you.
Thanks.
Sure.
Okay, back to welcome everybody back to public comments and or patient story. Any public comments?
Hi, Brad. This is
Yeah.
Kristen. I do have a public comment today. I wanted to let the CAC know that Assurance Wireless will no longer be the Lifeline cell phone provider in Oregon, and that will now be Access Wireless, or there's also a second option called N-Touch. As soon as we have our member-facing flyers updated, I'll make sure to send those over to Gwen and Michaela to send out to all of the CAC members. But if you have an Assurance Wireless cell phone, you will need to change providers, probably to Access Wireless. If I can provide any information to you while we're waiting to update the member flyers, please let me know and I can send you an email with more information on how to change that. And Access Wireless will be texting and sending letters to people on the plan.
Thanks, Kristen.
Mm-hmm.
Okay, let's go ahead and, is there a patient story? Sorry, I'm not aware that there is, but is there a patient story this month? No. Okay. Alrighty. So just to remind everybody, the last patient story was shared by Regina Sanchez, and it was around pediatric dental services. And that's been carried forward to the board. That was shared at the January meeting. And it's become our, I believe, our third or fourth emerging issue. So we'll keep moving forward on that. Do we have a quorum of CAC members? Do we meet our, oops.
Yes, we do.
Okay. How about then we vote on approving the meeting minutes from December? Are there any questions, corrections? Does anybody have anything to say about those minutes that didn't look quite right to you?
Todd, I would move approval of the notes.
Did I say minutes? Thank you, Ken.
You're welcome.
Ken has has recommended we approve the notes.
I'll second that. This is Tom.
Okay.
So that means you agree that they're good to go?
You agree, Tom?
Yes.
Yes. It takes time for those of us who attend lots of meetings with those old ways.
We're programmed. We're programmed.
Yes. So one last open space for, are there any corrections or questions about the notes from December? We'll chat a couple minutes. Okay. Was Elaine, is that relevant to now or to the notes? I'm sorry.
No, I just didn't see it as a continuing emerging issue. I had written it in a couple meetings ago as an issue in the community. So I don't think you have to go notes. Keep going.
Well, if you brought it up at the December meeting and you want to add it to the notes, we can do that, right?
Sure. I think I brought it up in November.
But
November. Why not add it to December?
It's more current.
Sure.
All right, I'll leave that to the staff. So with the addition of Elaine's comment, as you can see in the chat, are there any objections to approving the notes from December? And I would check in with each and every one of you, but that's going to take a while. And it's up to you to shout out. Okay, looks like we're good. So thank you, everybody. Full approval. Do we need to actually formally vote on those still? Or is the lack of objection considered approval? Yes, it's considered approval. Good. All right. Okay, let's move into our breakout groups. Who's in charge? We're going to spend our 10 minutes together getting to know each other. Everybody, I believe, has been really enjoying that. So You can always provide feedback if that's not the case or if that is the case.
So we have our question for CAC members today. Most of you that are in attendance today did attend the combined meeting last week with the board. So what are your thoughts or your feelings about the combined CAC board meeting last week? And then our guests, you're more than welcome to discuss, do you have any hopes for this new year?
All right. Well, I don't know about the rest of you, but it always feels too short. Our time together in the breakout groups. Let's see, how are we doing on time? 9:30. Well, very briefly, does anybody want to share anything from your breakout group time together? Just like 1 or 2 minutes, anything that anybody's just dying to say? No? Okay. Let's just take a quick poll then. How many raise your hand or scream or something if you can't wait to have these meetings in person? That was one of the big comments in our group, is getting out of this COVID world and off of all these Zooms. All right, well, let's go ahead and move forward. Our vice chair nominees and voting process. I'll turn it over to Michaela.
All right. So in November, your longstanding vice chair, Larry Kagofasic, hopefully I'm saying his name correctly, stepped down because he had other pressing issues or commitments. And so last month we asked for vice chair nominees. And so your nominees for this position are Elizabeth Schmidt and Regina Sanchez. And we asked the candidates to share a few words of why they would like to be vice chair. And then after this meeting, we'll send a survey out for you to cast your vote. And we'll also send out the CAC chair roles and responsibilities to reference as well. And Regina is taking some time off, so we may have missed her before she left, but we'll try to get a few words from her about why she would like to be the vice chair. But Elizabeth is here, and Elizabeth, would you like to say a few words of why this position interests you?
Elizabeth, are you there?
She was having problems with her microphone earlier. Might just give her a minute.
Okay.
Well, while we do that, how about Myra has joined us. Has anybody else joined us since we did our intros?
Am I unmuted now?
Yes, you are, Elizabeth.
Okay, now I had to step away for a minute, so am I presenting now?
Yes,
Or-
on the vice
Okay.
chair. Say a few words about why you're interested in this position.
Well, I've been interested since 2014 when it was explained to me, and I was told to Google, and I came up with an article from the New York Times, and so I was officially joined in the year 2015. So I've been involved all this time. Being in the CAC is really important to me. I'm currently reading a book on the Netherlands model of homelessness. They won't allow any tents. They put them in a shelter. I don't know what to say, except it means a lot to me. I've been involved and I'm ready to take on more responsibility. So I'd like to have this position. And before I got sick, I had a lot of leadership positions as a work comp adjuster and a voc rehab counselor. And but I've never talked about that. But I had a lot of responsibility. So then I got sick. Anyway, I just like to run for this position. Thank you for the time. That's it.
Thanks, Elizabeth.
Sure.
So we'll send out a quick little survey for you to cast your vote, and that'll come out about next week. We want to check in with Regina first. And you can either use that survey to cast your vote, or you can call us, text us, whatever is easiest to get your vote in. Any questions on the process? Okay.
Thanks, Michaela. And thank you, Elizabeth and Regina, for being willing to fill that role. Myra, would you like to introduce yourself?
I thought Elizabeth had saved me, but I guess you're going to put me on the spot, Brad. Sorry for joining a little late. Maida, consumer rep.
And just so you know, Myra, we want you here. We don't care if you're late. I mean,
Thanks, Brad.
if you're on time, that's great, but being here is better than not being here, even if you have to arrive late. So thanks. Okay, so survey is going to go out, but if you would rather not respond or vote on the vice chair position by survey, you can email or call. You want this to go to you, Michaela?
Yep.
Michaela, anytime. So on to community health projects, and that is back to Michaela.
All right. So last month you had a conversation regarding how you were going to allocate the extra 61,000 of community health project funds. And you decided to invite a couple applicants to fill out the full application for these funds. And they were Treehouse Therapies, as well as COCC's Connecting Students in Need to Basic Resources. And so we connected with both of them, and COCC already received funds for their project, which is great. And so Kelly sent out an email a few weeks ago to have you select a couple more projects to invite to fill out the full applications. And so the top of the list were Lifetime Vision and Thrive Central Oregon. And so we have asked those two additional entities, invited them to fill out the full application. All three of those applications are due by February 1st. And once we receive those applications, we'll send them out to you to review in order for you to make your final funding decision at your February 17th meeting. So hang tight, and we'll get those applications out to you at the beginning of February. Questions?
So Michaela, we will all be evaluating all three applications, correct?
Correct.
Okay. All right. Any questions or comments? Okay, I have a question just about community health projects in general. Have all the first 10 that we funded all received their funding and things are going forward?
Yes. Yep, they've received their funding. And I believe that they have yearly progress reports. And so once those come out, we'll share those with you.
Great. All right. Well, let's go ahead and move on. Hearing no questions or comments about community health projects. Go ahead and move on to our emerging issues. Follow up with Gwen.
Hey, everyone. So the end of December's meeting, in like the squirrely last few minutes, we had a few minutes to talk about emerging issues, and specifically around periodontal care, dental care, And before December, as this has been a topic of conversation, Kristen and Rebecca did some brainstorming, come up with an idea and a proposal for y'all to consider, to kind of move the whole topic conversation into a new light and to a partnership with DCOs. And so I'm going to ask Kristen to refresh us on that. And then what I'd like to do is move us into a conversation around just confirming this is something that you're interested in, which is something you indicated last month, and then to really look at what you want that time together with the DCOs to be like. Considerations of what you'd like to get out of it, what you want the experience to be like, power dynamics for all folks that may be present, just so we're considering those things as we structure, as you all structure that time together. So with that, I'm going to ask Kristen to kind of give a little summary of the idea that y'all were behind.
Sure. So just to respond to Brad's question, DCO is Dental Care Organization, and the 3 dental care organizations that serve Central Oregon are Advantage, Capital, and ODS. So Rebecca and I sort of brainstormed an idea to invite representatives from each of the 3 dental care organizations to attend a CAC meeting and hear firsthand the concerns that you have, the access issues you've faced, perhaps any concerns about the care that's been provided to you, and allow them to hear that and respond or not, whatever you'd like. But we do think it's important for them to hear directly from our members as these issues continue to come up. So that was our idea, was to have a panel of DCO representatives come and listen to your concerns and your stories, and hopefully, improve and provide better care.
Thanks, Kristen. So given just that very limited, that nothing's really been structured yet, do y'all have any just questions of clarity on what she shared so far before we jump into deeper conversation?
Just the timeline, would that be at our next meeting, a couple meetings out? What's the timeline look like there?
We were hoping March.
Okay.
Yeah, it takes a lot of planning to get executives here. So, and you all. All right, so just a quick check-in. If I could hear from a couple folks, what kind of excites you about this possibility? Just 1 or 2 people share out. Come on, you can do it.
I want to get real answers.
Okay.
Like we have in this packet about, now that's chiropractic care, but it's very honest caregiver, why I don't want to deal with OHP. I don't get paid. You know, I want to know why dentists won't work with OHP. Why?
Perfect.
And I know that they know.
Yeah.
I know they know. They're just not telling us. And why, I also have another question that I really wonder if, why is when, at least in my case, and I've heard when I originally had problems and ended up just to get dental care, had to lose 5 teeth. People were telling me, oh yeah, OHP always pulls teeth. Well, I've had that experience. Every time I have a problem tooth, the answer is to pull it.
So thanks, Teresa. That's great. So you're really excited about getting some more concrete, detailed information.
Real answers. Yeah.
Thanks.
Not pretending, because there's a reason why dentists won't work with them, because there are a lot of periodontists here.
Yeah.
And there's a lot of dentists, and there's a lot of pediatric dentists. They're here. Why won't they take us?
Perfect.
With ODS, at this point in time, you can't even get into ODS. You can't. And it's been like that for years.
I want to open it up to other folks too and see what's one thing that excites you, or maybe it's a piece, something that causes some hesitation. I want to hear from some different voices.
Hey, it's Connor.
Thanks. Connor.
Sorry, I'm out in the outside, so it might be a little noisy. But I think one thing that I'd like to know is if we could use dentists that we choose on our own, if we could be reimbursed out of pocket at whatever rate that OHP or these DCOs would charge. That might give us as consumers more and better options, as long as we understand that there might be an out of cost to us, but we could at least be reimbursed at the in-network rate by OHP or the DCOs.
So you're kind of excited about potentially opening some ideas and conversations about some different ways things could potentially be structured so that you can get care where you want it, how you want it. Super curious, anything that causes you hesitation or nervousness about meeting with the dental care organizations, executives, and people who are embedded in this work? Mandy, I just had to come off mute.
Yeah, my hesitation is just hearing, we'll look into it, we're working on it, and it's 3 years later and nothing gets done.
Gotcha. Yeah. So hesitation around is anything going to change, or is this another conversation? Yeah. What else? One other hesitation. I know they're out there. This is a safe place. This is us prepping for what's to come.
I'll chime in again. This is Connor.
Yeah.
Maybe that this is just a check the box thing for them, that the CAC and these organizations ask them to come talk to us. They'll hear us, and like I think it was Mandy said, that they check the box and they said they've given us answers and they've moved on.
Yeah. So is it going to be meaningful, like and outcome based? Thank you, Connor. I appreciate that. What is one or two things that you want the organizations to know before the conversation? What would you want them to know coming in?
I would like them to know the barriers that it's causing, like, for my situation, I have to drive to Eugene at the beginning of February. That's for an initial conversation, which means I have to go back to Eugene to actually get something done. So, taking off work, finding childcare, all of these different things that some people can't do and would just give up because they would have to drive, all the way to Eugene just to access this care. So the burden then it's putting on people and causing people to not deal with their issues, and then potentially have way worse issues down the line because they didn't want to deal with it.
For sure. So the real life stories y'all are experiencing, and some of the things that have come up in our meetings. So they have that background of what y'all have been talking about and dealing with personally. Yeah.
I think I'm going to piggyback.
Oh, so go ahead, Myra, and then I'll come to you.
Okay, I was going to piggyback right off of Mandy. The barriers that it's causing usually when you have people that have Oregon Health Plan as a coverage, the immediate care isn't immediate. You have to wait, or for supplies, whether it's, glasses or whatnot. Sometimes you have to wait for an appointment, and those appointments are like super far out. And so it's really hard to be able to get into dentists to see them.
Great, thank you. Yeah, so delays. And Teresa, and then Mandy, and then we'll move on to kind of the next question. We'll capture all these. Go ahead, Teresa.
I'd agree with her because part of it is like problems get worse because they don't get taken care of. The other thing I would like to wonder is, like, I've had the DCOs specifically talk to me and say, okay, we're going to put you with X or so-and-so and so-and-so. And we'd had conversations about them with you, or we've had conversations with them about you specifically. So I, and this is, I am a literal thinker, but I assume they know my case. They know me as a person, and I have found over and over that's not the case. So if you have these DCOs that are supposed to be protecting you as a patient and being your liaison, how come the communication is not getting through to the actual dentist? That is a really good question to me.
Yeah, thank you, Teresa. Mandy?
Yeah, I forgot to mention when I was talking about barriers, the financial barrier also, because while Pacific Source has this, awesome program where they will reimburse you for a hotel room and food and mileage, it's not enough. So it doesn't cover the whole cost. So you're also paying out of pocket to go to these providers outside of your area.
Yeah, for sure. Gonna shift gears a little bit. So y'all have totally been highlighting the difficulties that you want them to know about. And Stacy, you asked for some additional information and cost comparison and preventative and immediate care. Great question. So we got that. Want to make sure we saw that. My question is, so there's a large group of you. There's going to be how many, Kristen, organization reps joining, do you think? You're thinking 3?
Well, no, because I was thinking offering 2 seats for each DCO, because what I'm hoping is maybe a care coordinator can come and a dental hygienist, in addition to more of like the higher level folks. I think that could be helpful to hear from other voices within the DCO, but obviously open to feedback.
Yeah. Okay. So potentially 6, and there's 16 CAC members if everyone's present, with visitors and stuff. So thinking about, go ahead, Michaela.
Isn't there someone from OHA interested in attending as well?
Oh, yes. The OHA dental director had mentioned to Rebecca that he might be interested in attending. That's right. And then I also was hoping to invite an internal medical director from Pacific Source, Dr. Ash.
Okay.
So I'm sorry, guess the number grew a little bit more.
It's okay.
This is Sarah. If it's okay to jump in real fast, especially in the OHA perspective, and as I hear all of you, some of the needs you have, some of the things I've heard, and I'm wearing my OHA hat right now, are some of the things I hear in my OHA hat. I'd say Pacific Source, you go solve. And some of the things I hear, I say, those are policy things that I know Pacific Source can't think creatively about because it's an OHA Medicaid policy. So I might also encourage you, and I'll put this in notes to Kristen, to invite in listening only mode, so that OHA is not the experts. OHA is there to listen and not speak. A couple key people to hear some of what you're hearing or saying as well.
And what would be the the benefit and power of that, Sarah? Can you just?
Yeah, I think I even heard a couple really creative ideas around, reimburse for the cost we pay if we go to outward network provider, and knowing that that's, the Oregon Health Authority might come down on a provider if they're not following our actual rules around charging for Medicaid services. So there's policy things that we could do to support decisions and brainstorming that you have that are sometimes statewide Medicaid policies as compared to Pacific Source CCO policies. So there's a little bit of both in the needs and the problem solving. So, but I would also suggest that you still have this be you-centered and just have the OHA staff be in listening mode, or have specific roles so that OHA doesn't show up as the experts, but rather hearing from you to then be responsive to solve. OHA is shifting our course, and we know we need to co-create, learn, and hear and act at community's direction. And so that's an opportunity for OHA to hear community's direction and then figure out how to solve it.
Sweet. Thank you, Sarah. That's pretty cool. All right, here's the next question that kind of leads in. We touched on it earlier, but I want to, this is going to lead into another question around how the energy and the human side behind this conversation too. What would, in addition to like some concrete things, what would you like to see happen or start because of this conversation? I don't know that this is something that typically happens. So like big picture and concrete, what would you hope in the big picture would happen? What would you hope in the little picture might happen? Because we're coming together with these folks.
I would hope that they could get some of the dental providers here to start working with them.
Thanks, Mandy. Stacy, you put in chat a policy reform. So revising, and go ahead, speak to it for it.
Yeah, I was just gonna say that it seems like there's already the public support behind a lot of maybe policies that can't easily be solved within groups or within the OHA or Pacific Source even, that this is maybe more of a bigger issue that needs to be looked at in terms of, you know, going further up the food chain. Like I can't say that word, but you know, going to Oregon, going to Senate, going, you know, all those things. I don't think it would be hard to get public support for sure.
Absolutely. Thanks, Stacy.
If I could follow what Stacy just shared. So does that kind of raises the question, would there be value in inviting like Jason Croft or some, you know, a representative, Oregon legislator who would have, invite House representative who would have, you know, who could take that forward, carry it forward, and develop policy.
Got a couple other folks thinking on the same lines there. Brad, Stacy was saying so. So given the you know how this is growing, I want to pull us back into, you know, your individual values, the values of this group and the work you do, to kind of lead how you want this to feel for yourselves, how you want this to feel for the other participants. So what are some of the values that you want to hold during this conversation? Mandy, you put equity. Can you share a little bit? Equity means a lot of different things to a lot of different people these days. What does it mean to you right now?
Well, the ability for everyone of any income and situation to be able to access these services.
How does that tie into the conversation that's happening? Like, we're going to have an hour together. How would equity play into that conversation?
Just reminding them, I guess, that this is, you know, disproportionately affecting people who can't afford to just pay out of pocket to go to these providers.
Mm-hmm.
I would add to that training to maybe some of the providers to understand maybe those smaller minority groups or even low income in, how do I say it? Like, I don't feel like maybe some providers are as connected to some of the lower income communities and understanding what they have access to in their social environment. And that could prevent or enable them from getting the care that they're recommending. It could be seen as, sorry, the room just went dark on me, as being uncooperative, opposed to incapable of reaching the things they need, if that makes sense.
Absolutely. Absolutely. Yeah. What other values do you all want to hold in having the conversation? What are important things for you all to convey as a group to these potential partners? What flavor of relationship do you want to start with them? problem solving, and I see some nods.
I would say personally, like, no pointing fingers, no negativity, just get down to what we are here to do, which is problem solve. You know, there's issues, and how do we go about it? How do we work together? What is it that we need to know that we don't know? What is it that they need to know that they don't know, essentially?
Thanks, Stacy. Brad, do you want to speak to what you put in the chat?
Sure. Yeah, just the notion that we want to work together. I mean, we don't want to be confrontational, you know, and create that environment, but at the same time, you know, we also don't want what we are sharing to fall on deaf ears. So, you know, definitely want to start and hope to stay non-confrontational. And hopefully they are responsive, and hopefully they're already working on some of these things and give us concrete examples. But in the case that they're not, that they're showing an openness and recognizing the validity of what people are sharing. And, you know, often I don't know if the three higher ups or any of the people that you would be inviting, I don't know if any of them live here in our region. If they don't, the likelihood that they understand, you know, our lives here in Central Oregon, in particular Medicaid, OHP families' lives, and how they interact and experience the medical and dental care system, likelihood is they don't have a very clear picture of that. So it's going to be, you know, really valuable to provide them with a picture of that, and then try to work together to improve our system, improve our care.
Thanks, Brad. Connor, Myra, Ken, Tom.
Yeah, I think for me is there's probably a lot that we don't know about their processes and their what they have to do, and they probably don't know a lot about what we have to go through. So I think just having that discussion so we both understand where things are being missed and how we can close that gap.
That's sharing.
Connor's thinking along the same, I'm thinking along the same lines, Connor, thinking about, again, that we may want to poise ourselves so that we're doing a fair amount of open listening, open-ended, or what we said, it, unbiased listening.
Well, I know for sure that providers have to do specific processes if you're OHP in order to get reimbursed. I don't know what those are, but I also know, I get the impression they're pretty cumbersome. So,
yeah.
And I'm guessing it comes not only from the state level, but also the federal.
Yeah.
So.
Yeah, so I'm hearing really the openness and wanting to be able to hear everybody, to hear both sides, the stories and the nuance and the difficulty that folks are experiencing. From your side, from your experience, especially, but also wanting to gain understanding and knowledge that they've got their barriers that they're working with too. And so coming together for that collaborative, positive problem solving, non-judgmental, standing at the same level, if you will, you know, leave your name tag at the door kind of thing, or leave your title at the door kind of idea of coming together to work on this. What would you like, how would you like this to impact your relationship with the folks that are coming? Is this a one-time deal? Would you, or, you know, or what are you thinking? So thinking long-term, how do you want this conversation to impact your relationship with these folks?
Positive, someone who we could maybe call on if we need help. I think everybody prefers a positive interaction and somebody that's a resource or just an acquaintance, opposed to, oh my gosh, I see someone's car parked outside the store, I can't go in there now.
What? Connor, I see that you're unmuted.
Yeah, I was just gonna say, I think, if we come into it that they're trying to help us and we're trying to help them, instead of looking at it as an adversarial type thing, which I know some of us have had, difficult experiences, but maybe just looking at it that, we're all on the same team trying to go towards the same direction, or at least that's what I naively hope.
For sure. Teresa? Yeah.
I'd like to see it ongoing, because I think one of the frustrations is we've all experienced is we'll get the story that or the response, we understand that, we understand it, we're working on it. But then literally 2-3 years go by and nothing's changed, just the same comment. So I think if it's ongoing, gotta make at least a little bit of progress.
Yeah.
Even if it's baby steps, it's something.
Mm-hmm. So true. So I'm gonna totally pull on support staff. I'll be right there with Brad, with you. I see you. Hold on. Support staff, Michaela, Kelly. I imagine somebody's maybe jotting things down. I have recall a few things. Could you share out what you've heard so far around what are some of the main points the CAC wants to share? Because my next question is to the CAC, how do you want to share these with them? So, but let's refresh on some of the things that have come up so far, because we're going to kind of go into the last 5 minutes decisional points on how to structure some of the time together, what advance materials all folks might want before we go meet. So Kelly, Michaela, I'm totally putting you on the spot because I didn't ask anybody to take pencil notes.
I was jotting down a few things, but I was also multitasking a little bit.
And Kristen's got to be jotting things down. So between the staff, oh look, you've got lots of. Okay, Kelly, you're off the hook. Kristen, you're on the hook. You got to. Can you just read them off really quick to refresh our memory?
Yes, I love to take notes, so I have Post-its everywhere. So why won't dentists see OHP members? Would it be possible for a consumer OHP member to choose their dentist and apply for reimbursement with the understanding that out-of-pocket expenses may apply? Worried that the meeting, there might be like a non-response, or will there actually be change from this conversation or continuing conversations? Also a concern that this could be like a check the box type activity. Letting the DCOs know about the barriers like traveling to have care and the out-of-pocket expenses. This also causes burdens on people regarding childcare, work, and things like that. Or it might cause them to avoid care and get worse and potentially have a more expensive procedure needed. Appointment wait times and delays. Also sort of having to retell your history and the story every time you come to be seen. And then some of the hopes would be that we could have more OHP dental providers in Central Oregon, policy reform that brings better care, equity, for example, what kinds of trainings are our dental care organizations receiving, specifically around the Medicaid population. And then we're hoping that this discussion is problem solving, collaborative, respectful, and having an opportunity to discuss the issues and work together to come up with some solutions. And then trying to determine if there's ongoing discussions, which is sort of my hope. I almost hope that this is like a pilot. And if it's successful, that we do continue to have like an annual listening session so they can also, give you guys feed or progress and say, the work that they're doing to address your concerns. That's what I had.
We're getting you a gigantic Post-it notepad for the next time.
I need the lined ones. Yes.
I was going to say that definitely covered what I had as well. So
great.
So my question, you're right, I know notes in classes. Brad, I saw your question in the chat, so we'll capture that and we'll visit that. My question for you all is like, how do you want to prepare the DCOs? There's two, because we are down to 5 minutes. what do you want the DCOs to know before they come? And what do you want to know? What do you want before the conversation? So think about that. You can put it in the chat. You can say it out loud. So what do you want the DCOs to know before they arrive? And that's soft, feely stuff, human stuff. And it's also, here's the crap that we're dealing with. Do you want them that ahead of time? Do you want to share that with them during, what, that kind of thing. And what do you want as a CAC member before the conversation? Mandy, go ahead and share out. You say the barriers we've shared so they have time to reflect or to do any research into it. Give them some preparation time.
Right, just in case they want to talk to some folks or just have some kind of response ready to go, just having that information available, I think would be helpful for them.
Mm-hmm. No surprise questions, says Tom. Tom, can you speak to that a little bit about?
Well, I think anytime we're having someone from outside of any group or committee, if we have some difficult questions that we want to ask them, for instance, we had our new county administrator come to our all staff meeting, and a few of the questions were a little more difficult, where if they weren't prepared, it could make them look bad. So we at least want to give them the question in advance so they at least could consider that. So I think it's always just more fair, and it makes them feel more comfortable if we prepare them at least for the difficult questions.
Mm-hmm. For sure. Brad, you put grievance and appeal statistics, some information related stuff. What do you want them to know about what to expect when y'all meet?
I'd say our purpose, our goals. Our goal is long-term relationship that makes it better for patients while working with OHP executives.
Right.
That it's not about, we just want to attack you. I mean, we wouldn't say that, but we do want to attack you. I mean, we don't, but frustrated patients come across as angry because they've jumped the hoops. That's me.
Yeah, we're frustrated. Yeah, I'm a frustrated teenage mother. I get that.
Yeah, but that's our goal. Why we want to do that. This.
Nice. Tanya, can you share what you just threw in the chat?
Yeah. So Stacy was asking about policies. And so I included one of the Oregon administrative rules that talks about some of the policies that apply to DCOs and CCOs. It's a little technical, but it talks about access to care timeframes and like that a member should be seen for urgent dental care within 2 weeks and routine care within 8 weeks, et cetera, et cetera. And then there's a more plain language version of that in the DCO member handbooks. So you could find that there as well.
Okay, so thanks. So a little bit of information on our part. So big question for the last 2 minutes. How do you want the conversation structured? Like if you were to build out a quick agenda and you were penciling it in on your 1-by-1 Post-it note. We got introductions. What do introductions look like? Or do you do introductions? How do you want it structured? Agreed topics and time frame for each topic. This is like the start of a relationship. It's like your meet and greet in some respects too.
I think agreeing on which topics take precedent and then how long we should talk about each. If we get a quick answer for each, then we could maybe add more time to the ones that are needing more time, or somehow categorizing it from the most important, maybe the most lengthy one, and then the other ones, if we don't get to them, some kind of email, if that makes sense.
Absolutely. Yeah. So we'll have an hour. An hour is going to go by fast. How would you like to structure the conversation? Brad, you're asking, will Teresa and Regina's stories be shared with them? What do y'all think? I'm gonna put that back to you all. Those are your stories.
You can share my story. I think it's impactful. And I don't think it's, I think it's a dime a dozen. I think everything. And my story actually started out as a grievance, which I filed, and I've never gotten any feedback at all. So,
yeah, so we'll reach out to Regina and ask. Mandy will come to share. So, and we'll probably, I think with HIPAA, we'll probably leave y'all nameless and you'll be able to share independently as you want.
Yeah, don't get yourself in trouble. But, you know, I think it's helpful because I think it's a pretty strong story. So,
yeah, they're all very strong stories. Sarah.
Yeah, Tressa, I think what you said of your story is a dime a dozen, and actually, and I also manage our Oregon Health Authority Ombudsman's program, so I'm speaking a little bit outside of what Rebecca might say here, but I know when someone comes to our Ombudsman's program, or when someone like you, Tressa, shares your story, you do that because you're an advocate, and you're doing that not just to resolve it for yourself, but because you know others have experienced and are experiencing the same thing. And I think particularly as you elevate those stories and experiences and spell that out, because people forget that, it's incredibly powerful, and it's part of that advocacy that you're doing. So I just wanted to recognize the value in that. And one story that came to our Ombudsman's program was of a woman who said she no longer needed her assistance, and this wasn't a Pacific Source owner, but because she still needed dental care, but was too tired fighting and could get a job because she was wearing a mask and she couldn't get a job before. That's an unresolved story, and yet speaks to how impactful dental care it truly is.
Thank you, Sarah. That's a great closure. We've got obviously lots of, we're going to close this up to move on to our next agenda item and let Miguel and Leilani present. And I want to thank you all for really putting together what you want this conversation to be like, what could be included, how to prep everybody for it. So thank you so much. I'm sure we'll be touching on it in February to prep for March. All right, and with that, I'm going to hand it back to Brad.
Thanks, Gwen, and thanks everybody for your great participation. Gwen, would it be possible for us to have a draft meeting structure that we can all review and talk about in February?
We can definitely look at that.
Okay, I think that'd be good for us. All right, well, welcome Miguel and Leilani. I'm going to turn it over to you to talk about Health Equity Plan update and grievance and appeals.
Thank you so much, Brad. So thank you, Leilani, for being here with me. She's part of our diversity, equity, and inclusion team. And also Jessica Wallman, the manager of grievance and appeals. That is the main focus of this meeting. So next slide, please. We only have 15 minutes and a video that we want to show you that is almost 5 minutes. So I'm gonna fly over all the presentation, but obviously, if you need to contact me later for any questions, then you come back. So I will come back. So first, the purpose of this presentation is to give you an update about our health equity plan 2022, and also we have already our new brief reviews version that is available. We are going to send it to you after this meeting. We want to share with you a grievance and appeal resource, new resource that we are putting out to help our members to understand how to pass through this process that for many people is complex and cumbersome. And we are going to call grievance GNA in the future, but it's grievance and appeals. And then obviously, if we have time to get some of your ideas, I'm impressed about the quality of the conversation. I was just listening. Fantastic, guys, really, we appreciate you so much. Next slide, please. Yeah, so the health equity plan update. As you know, this is a community-based informed plan. So that means that we were there asking you what was your main concerns, what it was needed to do. This is the opportunity, what you and everybody has the opportunity to update these reports and change and add topics to our regional needs. And as a reminder, the entire health equity plan of Pacific Source is based on the national culturally and linguistically appropriate services, the class standards that we have presented several times before this. So interesting, this is just a reminder about the focus areas that our health equity plan has. You will notice in blue that usually we collect real D information, which stands for race, ethnicity, language, and disability. And now more and more, you are going to hear this SOGI term, which is sexual orientation and gender identity. This is a new and improvement on the collection of data that we are going to begin this year. This is great. It's going to help us to understand better the needs of the different communities we work with. Thank you. Next. Super interesting, a new health equity focus area for our health equity plan. This is something that we are so excited. We just beginning to think about. And at the end, if we have time, I will come back to you with some to see if you have some ideas about what is this new focus area. The Oregon Health Authority is asking you to support advancing the health equity, but also through community partnerships. So we want your ideas about this. What is true community partnerships for you? Next slide. So let's jump directly into the first part of our presentation. It's about grievance and appeals. So the communities told us that it's difficult to understand this process. And also, particularly in rural or small communities, we found people that was scared or reluctant to make a grievance because of fears of retaliation, which is totally understandable. Next slide. So in order to help make things better, we are doing trainings for health workers, trying to put some strategies to increase the member comfort about these processes, add language that remembers the member that we are supporting this, that is important for us to have this feedback, and creating some resources like the one we want to share with you at the continuation. Yes. Next slide, please. So the video we are going to share with you, this is what the main focus of our presentation today. Thank you, Leilani.
Problems with your coverage? Pacific Source can help. One of our core values is that we're each responsible for our customers' experience. This means that every Pacific Source employee is dedicated to making sure that you're happy with your healthcare coverage. That includes all the care you receive. If you ever have an issue or concern with your coverage, we want to hear from you. We're here to make sure your questions are answered. At Pacific Source, we honor and uphold your privacy. We support your right to receive information about our services and providers. We encourage you to participate in decisions about your care. Above all, we want you to be treated with respect at all times. First, let's start with some of the reasons you might need to reach out to our customer service team. You might contact us if you have questions about your coverage. You'd like to change your primary care provider, which is the doctor you see regularly. you have a concern or complaint about your healthcare or your Pacific Source coverage, or you were denied coverage and you want to know your options. Naturally, we take your complaints and concerns seriously. Complaints and concerns are called grievances. A grievance is you telling us you are unhappy with some part of your healthcare or your Pacific Source coverage. Healthcare grievances may include issues with the healthcare or service you receive from any healthcare provider. Examples of providers are your doctor, a social worker, your dentist, or a specialist. They can also include concerns about your healthcare bills, or they can be problems that are keeping you from getting the care you want and need. Plan grievances may be issues with using your plan to get care, concerns about your plan's follow-through, a difficult experience you had with the provider, or other problems with your coverage. So what do we do about grievances? First, we investigate to find out what happened and why. Only when we understand what you're going through can we begin working to promote positive change that benefits you and all of our members. Next, we address issues and provide you with a response, giving you information from our investigation. We'll contact you by telephone or US mail to let you know that we've looked into the things that concern you. One of the ways we keep you informed about the process of a complaint is for us to look into your experience through one of our grievance coordinators. You'll receive a note from us within about 10 days to let you know about our review. As a rule, we'll respond to you with information about our review of your concerns in around 30 days. In some cases, it may take longer. Also, keep in mind that at times, Pacific Source denies coverage of services. Reasons for a denial are usually because of the rules and requirements of your coverage. If you don't agree with our decision, you can appeal. An appeal is asking us to change our decision and approve the denied services. We take appeals seriously. An appeal involves looking into the coverage decision, getting more information, and revisiting our original decision based on new information. Your voice is important. If you disagree with the coverage decision, we try to make the appeals process easy so it works for you. For every appeal, we investigate to find out what happened and why. In our appeal decision, we tell you the results of our review. When we say members first, it means a lot of things. For example, Pacific Source will not penalize you in any way for telling us about a grievance or filing an appeal. Both grievances and appeals are part of your plan coverage. It's a vital part of what we do. We encourage you to use both grievances and appeals whenever you think they're needed. As a member, your experience with your Pacific Source coverage matters. We're here to help you get the most out of your plan. And we don't tolerate discrimination, bias, favoritism, or retaliation in any form, whether it's from us at Pacific Source or from any of our contracted providers. If you experience discrimination, retaliation, or poor treatment from us at Pacific Source or from any provider, please let us know immediately. You can reach us between 8 a.m. and 5 p.m. Monday through Friday. If you have a Medicare or Medicaid plan, call 1-800-431-4135. If you're on a plan through your employer or have an individual or family plan, call 1-888-977-9299. If you're a TTY user, call 711 or 1-888-735-2900. We accept all relay calls. Or you can email customer service at cs@pacificsource.com. We're here to help.
Thank you so much. So that is the video. Thank you. We know that it's already 1:29. So we don't have time to go to the rest, which is the comments about the new focus area. But please, let's take this minute to talk about this video. If you have some ideas about what we are missing, how to make this connection with the members better, please, we are here to listen. At least 1 minute, even less.
Thanks, Miguel. Is there any feedback for Pacific Source from Miguel on the video in particular?
I like the video. I think it really focuses on opening up communication for some of the clients or consumers that may otherwise feel unheard or incapable of speaking up.
Thank you, Stacy.
Miguel, this is Sarah, and sorry if I'm speaking out of turn. I'm curious if you've ever been able to look at appeal rates by Pacific Source members by race and ethnicity and language, and if there's the same number of a percentage of appeals across the Pacific Source Oregon Health Plan population, or if it differs by race and ethnicity. And you may not have looked at that. I'm just curious.
That's a great question. We are just beginning to understand and get better collecting the information to make those studies separate, because we really need to know that. I don't know if Jessica, which is the manager, has already explored that, but this is one of our focus for the next year. And not only doing by real the information, but also include the new SOGI measure. Thank you, very important for us.
Thanks, Miguel. To answer the question, we have done some pilots capturing data and are starting to do that analysis. I think I'm a little ahead of ready to sort of put that analysis into prime time. We want to grab more information, expand on the collection. One of the things that has challenged us is sort of the overall amount of that information that we're able to acquire for our entire membership. It is a challenge to get some of that specific information. So when we're doing that analysis of appeal rates across the spectrum of race and ethnicity, it's really relevant, the amount of data we have around specific race and ethnicity. So hopefully that helps in some feedback there.
Thanks, Jessica. Myra, Elizabeth, Ken, Tom, anybody else want to share anything?
Thank you so much.
Miguel, if people want to share feedback with you offline, how can we do that?
Please send it in the presentation is my email. Write me or call me anytime, and I will be happy to come back to you and connect with Jessica anytime.
Okay. Gracias, Miguel.
Thank you.
And Leilani. All right. Well, that wraps up our time together today, this month. Any final words?
I'll be sending out an email to everyone with the presentation and video link from Miguel and Leilani and Jessica. So keep an eye out for that.
All right, well, thank you, everybody. Great participation. Thanks. Have a fantastic weekend, rest of your month.
Thank you.
Nos vemos.